Hello there, I'll be with you in just a second. Hi, how are you feeling today? Good. Well, I'm Surgeon Sarah and I'm going to take care of your ear problem today, okay? I can see that you've got some ear tubes, grommets, inside your ears, okay? Yeah, and they seem to have slipped behind the eardrum, okay? Yeah, the doctor has referred you quite urgently to me because they just need removing if they're not going to come out on their own, and they won't now because they've gone too far in and behind that eardrum. So you're getting some pain, aren't you? Yeah, okay. Well, don't you worry. I'll take a nice look at you first, okay? And then we'll get to work. All right, do you have any questions for me? No. Okay. Well, I can see all your general obs have been done by the doctor, so that's really, really good. I will just have to get some gloves on first. And we'll get you feeling better. It's really, really uncomfortable, isn't it, when these grommets slip? Okay. It doesn't happen that often, but yours have been in quite a while. Okay. Alright then. So firstly, I need to clean around your outer ear before I touch anything inside, alright? Okay. Some special wipes here. Okay. Right. I'll take a look at your left ear first, my lovely, okay? So there we go. I'm just going to have a little gentle wipe around. Okay, very gentle there, just to sanitise the ear. I know this may be a little bit sensitive for you, my lovely, but I'll be very, very gentle, I promise. Okay. Alright. There we go. That wasn't so bad, was it? No. Okay, let me just take a look at this right side for you. Okay, just around there. Perfect. Okay, that's all good. Do you have any pain in one ear more than the other? Okay, they're both quite sore. Alright then, okay. Well, I'm going to have a little look down the ears first, okay? I'll need to clean anything out of the way, alright? Clean up any discharge before I go down there, okay? And I'll clean that with a micro-suction tool, okay? Okay, so are you having pain in one ear more than the other, or about the same? Okay, alright. Well, I'll need to clean inside the ears a little bit, okay? That's to remove any discharge and nastiness before I start to remove the grommets from behind the ear drum, alright? Okay, I'll be using a microsuction tool for that, okay? It won't hurt you. I will use some anesthesia drops down the ears first, alright? But I just need to take a look with the otoscope before I do anything else. Is that okay? Alright. Okay, so here's the otoscope. Alright, so this light just goes down the ear. I know you've had plenty of that recently. I'll be very gentle because I know that your ears are really sore right now. Okay? Alright. I'll just pull up and back very gently, my lovely, and insert this and take a look. Okay. There we go. Alright, yeah, I need to give these a clean. There's some wax and a discharge build up in there, which I would expect. Okay. to remove that because I don't want to poke about too much in there because it's sore. Okay. Alright, let me just have a little look in this side. Just relax, take some nice steady breaths for me. I'm sorry it's a little bit uncomfortable. Just going to pull up and back there. Okay, and insert. There we go. Same again here. Very, very wet with discharge from the irritated ear. And a little bit of cerumen earwax. Okay. Alright. Let me just remove that. Okay. Perfect. Right. I'm going to get you covered up before I do anything. Okay. Just going to put a little bib around you, if you don't mind. Okay. There we go. Put that round there. Perfect. There we go. And need to put some covers just around the ear. Alright. These are really nice and comfortable. Just help to protect everything. There we go. Put one on there. That's lovely. Okay. Alright. I'm going to pop some anesthesia drops down your ears, okay? This will just make everything so much more comfortable for you. Alright. These won't sting or burn, and they soon take effect, okay? Right, I'll do this ear first. Right, there we go. Nice and still for me. And there's one. And two. 3. And 4. There we go. Well done. Make sure that doesn't drip there. Wonderful. It'll all start to go very, very cool and numb now. Alright. Okay, let's do this side. Okay, there we go. 1, 2, 3, 4. There we go. So, what I'm going to do is use the microsuction tool. I should just get this there very gently. Okay. And this will be inserted inside your ear. Okay. And you can see that there. And there is a little light on it. And it has a little vacuum. Okay. And it very gently sucks away any debris in the ear. It can be earwax or fluids, just like you have now, okay? You'll hear some very strange sounds while I'm doing it, okay? You might hear some glugging sounds, you might hear some like crackly sounds, okay? But don't worry, it's all normal, alright? Okay, alright. Well, let's do this ear first, shall we? Okay? So all I need you to do is just stay really, really relaxed while I do this, okay? Don't move. If you need to move, cough, sneeze, just pop up your hand. Alright, my lovely? Okay. Right, so let's get to work on this then. Alright, so I'm just inserting the microsuction tool now. Okay, and away we go. Strange sounds. Tell me if anything's uncomfortable. Pop up your hand, please. How's that? Good. That's looking much cleaner now. Alright. And let's move on to this side. Same again. Just going in now, some strange sounds. Alrighty, that's that cleaned. I'll just double check it all now with the otoscope again, okay? You didn't feel that, did you? No, I know it sounds a bit odd, but let's just pop that there, okay. So a little check with the otoscope again now, okay. Right, here we go. Just going to gently pull up and back on your ear one more time, just a very quick check. Okay, here we go, and inserting now. Okay. Perfect, that's looking great, I can see right down now. Okay, let's withdraw that. You okay there? Good. Don't forget to tell me if you're not. Alright. Okay. Alright. Put that in. That's good. Really clear now. I can see what I need to do. You're very lucky because these grommets are just where the little hole is, so I can get those without having to make a further incision in your eardrum. Okay, that's perfect. Wonderful. Okay, so now I've cleaned the ear out, I'm just going to pop another couple of these drops in just to make sure it's very numb around the eardrum, okay? They're not going to harm your ear in any way, alright? Here we go. Okay, come round here. There's the one there. Two. Just one more. I'll let you rest there for a second while I'll just make a few notes and get a couple of things together that I need just to get those grommets out. Okay? Alright. Okay then, are you ready? Alright. So I'm going to be using some special tweezers that I have here, okay? And they'll reach down and be able to pull out that grommet, okay? If anything's uncomfortable, please keep still but pop your hand up, okay? You'll probably hear me doing some little snippy sounds as I just try and grab hold of that ear tube, alright? Okay. And then afterwards I'll see what I need to do with the eardrums. Sometimes we can just let them close up naturally, which is our preference, but if there's any risk of infection, we do sometimes use a little bit of a glue to glue them together, but hopefully I can just leave these, but I'll check. Alright then. Okay, so I'm going to make a start with this side, alright, and I'm going to start trying to remove this ear tube for you now, alright, okay. I'm just going to get that there. Just need some of my tissue. That's perfect. Right then, okay. Keep nice and still for me, my lovely, and you will hear some little sounds as I do this. Okay, here we go. right there. That's good. You're doing really well. Okay. I think I've got a hold of that. Alright. Just got to be very gentle how I remove this. Okay, there. Okay. That's one out. That came out really easily. This one looks a little bit tighter, so we'll see what we can do with this one. Alright, my lovely, keep nice and still for me again. Just popping in those tweezers, special tweezers. Okay. I've got it. It's a bit awkward, this one. Got you. Okay. That's out now. Perfect. Right, they're out. So how does that feel? You still numb? Okay, that's great. Right, I do need to have another look down with the otoscope now just to see. Alright, okay. Just going to pull up and back very, very gently. There we go. And just insert that there. There we go. Okay. Alright. Yeah, the hole is quite small there. I think that's going to heal over on its own. Alright. I'm going to put some antibiotic drops down there, and I'm going to give you some antibiotic cream to put down there as well for when you go. Alright. Yeah, okay. You've done really, really well. I know they were very sore, so I'm really proud that you've done so well with this. I know you weren't keen on this procedure, but if you numbed up well, it's not so bad, is it? Right then, there we go. Just going to insert that now. There we go. Yeah, that's good. Okay. I think I'm going to just leave that to heal over as well. Just withdraw that. Right. The holes are quite neat and quite small, okay. You may get a little bit of drainage from them, alright, for a little while, but they will heal over, okay. Yeah. I don't really want to seal them up when they're not so big, if you see what I mean. If there was a huge big tear, we would glue them, but I think because it's just really the size of the grommet, just a very tiny hole. Alright. It's just been unfortunate that they've both gone down, but at least we've got them out. Yeah. Okay. So I'm going to pop some different drops down now. Let's get those. The numbness should wear off in about an hour. Okay. So I would recommend that you just take some painkillers, not paracetamol. Okay, you can also take ibuprofen. It's an anti-inflammatory. They might feel sore for a couple of days, so just keep the meds up, normal dosage for a couple of days. If you start to feel any pain, temperature, feeling unwell, then obviously just call us, okay? Hopefully that won't happen. These are antibiotic, alright, and then I'll send a prescription out for you to collect with some special cream that you just inject down, okay, twice a day for 5 days, and that should help prevent any infection, alright? Because anywhere where something's open is very easy to get infected with bacteria. Okay, so let's just pop some of these down to get you nice and comfortable. There we go. Okay. In fact, I'll just give that a little bit of a wipe. Don't want it running everywhere. Sometimes they run out a little bit. Okay. On this side. How does that feel? Right. I'm going to give your ears a little massage, okay? Just very gently help those down. Feels nice, doesn't it? Yeah. Okay. There we go. Perfect. Let me just get that prescription. The cream. Just get ready for you for when you leave. You're not feeling any dizziness or anything like that at the moment, are you? No. Good. Just sit there quietly. We'll get you a cup of tea and some biscuits when you've left here into the next area. When you get your prescription, we'll look after you there. The nurse will take really good care of you, just to make sure that you're not wobbly. And someone is collecting you, aren't they? Yeah. Perfect. Okay. So, as far as bathing, showering goes, okay, I'm going to give you some little dressings that you can just pop over your ears, okay, if you need to take a shower. Try not to get them wet, alright, at least for, 5 days, okay, but I've got some dressings here. I'll show you what they look like. Okay, so they're just a dressing which will just fit over the ear, just like that. I won't put any on now because you don't need them on, but they are waterproof, okay, and you can just pop them over if you think you are going to get some water in that area. Alright, we'll make sure you've got plenty of those. My nurse will sort that out as well. Okay, and to open them, you just open at the top like that, pull off the back in and just press it over either side. Okay, very easy. Alright then, so, are you feeling okay? Good. I'm just going to remove the covers now. There we go. I'll remove your apron that I put round you. There. Okay, and I'll just come and remove the cover from this side. There we go. All good. So, I'll leave leave you in my nurse's capable hands, okay? She'll get you a cup of tea and some biscuits and that prescription and a little aftercare leaflet. And do feel free to call us at any time, okay? Alright. Okay. Well, enjoy the rest of your day, but do rest, okay? Okay. I'll see you in about a week's time for a follow-up. Alright. Okay. Bye-bye. Hello there. I'm Surgeon Sarah, but we've met before, of course. How are you feeling today? Okay. Oh, it's understandable to be a little nervous. But I can assure you I'm going to be performing the most effective, simplest method for repairing your eardrum today. Okay? It's done without general anesthesia, and recovery is obviously a lot quicker. Yeah. So you're in safe hands. Okay, do you have any questions before I start? No? Okay. Just need to pop on my gloves before I can near you. You'll be glad to get this eardrum repaired, won't you? Yeah. It's not unusual for the eardrum to not heal quickly or fully after a grommet has fallen out of the ear, okay, which is what's happened in your situation. And plus you've had a bit of an infection as well, so yeah, it's a procedure that I've performed many times in different ways. But I'll need to take a little look at you first, okay? So, firstly, I'm going to just take your temperature, if that's okay, just to make sure we're all good. Okay, just keep nice and still for me. Just insert this into the ear and you'll hear a beep or two. Okay. There we go. That's perfect. That's perfect. No problems there. Okay. So, I'm going to just have a little palpate around the external ear. Okay, and I want you to tell me if anything's painful. Alright? I'll start with this left ear again, if that's okay. Yeah. Alright. Okay. So I'm just going to have a press around the ear. Okay. Anything painful? Just going to gently tug on the ear here. There we go. Okay. Alright. Okay. Is that okay for you? Good. That's fine. So that all seems fine, and this is the side that I'm going to be working on today, but I will just check this ear as well. Okay. So let's just have a palpate around the ear. Okay. And a little tug, does that hurt at all? No. Okay. That all looks fine. Lobe looks fine. No lumps and bumps. see any lumps and bumps on either ear, so that's perfect. Okay. And the next part, I'm going to have to do an internal ear exam. I'll be as gentle as possible, but if you feel any discomfort, particularly on the side with the perforated eardrum there, just let me know. Okay, I just need you to keep your head nice and still for me. Alright, thank you. I know you've seen one of these before many times, all the problems you've had with your ears. I know. Okay, so I need to just pull up and back on the ear and gently insert that otoscope there into the ear canal. Alright, okay. So I can see that we've got a little bit of discharge, a bit of fluid coming through that eardrum, which I would expect. Okay, but it's not infected, it's just a little bit of fluid from behind. The rest of the ear canal, I'm just going to reposition that. The rest of the ear canal is looking okay. No problems there. And the structures of the middle ear, which I can see, are looking fine too. Normally they would be concealed behind the tympanic membrane, but obviously yours has got that little hole in it. It's being very stubborn and won't heal up. Okay, beautiful. How does that feel? Good, 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 good. Well, I'm glad about that, because obviously I'm going to be doing a bit of work on this ear, but I will be anaesthetising it, so don't worry anyway. But there are going to be a few little tools going down that ear canal. Okay, I'm going to withdraw gently now. There we go. Thank you for keeping so still. I will check this ear just to make sure that this eardrum is good. Alrighty. So just pulling up and back and inserting there. Alright, okay. Is that comfortable? Okay, this eardrum's absolutely fine. It's perfectly intact. There's no bulging, no wrinkling, no bubbles, absolutely fine. Ear canal, normal amount of earwax. That's healed good after your grommet, that's perfect. Okay. Have a closer look there, just reposition a little bit. Okay. There we go. Okay, yeah, I'm happy with that. Wonderful. I'll just gently withdraw that now. There we go. That's perfect. Okay. Could you just open your mouth for me? Okay. Just going to have a little look just down at the bottom there. Make sure that looks good. Right. Just going to use these here. Just open your mouth a little bit wider and depress your tongue, okay? But they won't hurt, okay? Alright. Just relax. So, just going to come in and just open there. Just depress there. Just close your mouth, swallow for me. Thank you. And open wide. Perfect. Okay. Alright. Okay. I'm just going to depress your tongue so open nice and wide. Okay. Just going to have a look in the back there. Okay. Say R for me. Okay. Lovely. Could you just put your tongue to the roof of the mouth? Okay. Wonderful. And you can relax now. Okay. And just a little check up your nose. Alright, this might feel a little bit uncomfortable. Okay, I'm just going to push your nose up a little. Okay. There we go. Just look up there. Okay. And this side. Alright. That's good. That's good. Okay. So next I'm going to pop some anaesthetic drops into the ear, okay, and that will get the whole ear canal and the eardrum nice and numb, okay, before I do anything else. Okay. These might give a little bit of a warmer sensation just for a few seconds, but it won't last long. I have to give these a little bit of a mix. Make sure it's all good. They're very special ear drops. Okay, they're looking good. Okay. Keep nice and still for me, and remember, just feel a little bit warm. Okay. Got some paper around your ear in case anything does drop out there. Okay. Perfect. Just a few more. There we go. Just a few more now. There. Okay. Just give that a little massage. Can you feel that warmth? Okay. It shouldn't last too long. You feeling all right? That's perfect. Okay. So what I'll do next is I just need to have a little move around your ear with this tool here. Okay, it has a light on it, but I just need to insert that into the ear and just remove any little bits of wax that might be in my way. Okay, there's only a few little bits. Yeah. Okay, just going to give that a couple more minutes to make sure it's numbed up. Okay, so I'm just going to be using this, as I said, and just going to move it around in your ear and just be removing any little loose bits of debris. Okay? Keep nice and still again for me. Thank you. Okay, so just insert that very gently there. You just hear a few little scrapey sounds. You shouldn't feel anything. Is that numb now? That's perfect, thank you. Okay, I think we're looking good. Okay, so that's all prepped up now. Okay, so what I'm going to do now is I'm going to give you a local anaesthesia injection behind your ear, and when that's nice and numb, I'm going to make a very small incision into the area. Just remove a very, very small piece of tissue, and that's the tissue that's going to repair your eardrum. Alright? Okay. So, got my syringe ready there. Okay, so you'll feel a very, very, very short prickling sensation, okay, as it goes in, and then you'll feel nothing. Okay, so just got some cleansing drops here. I'm just going to pop some of those on some paper. Okay, and just gently wipe behind your ear. Okay. All right. Okay. So just that's good, all good. Keep nice and still for me, and I'm just going to get that numbed up behind your ear, okay? Okay, so just going to feel a sharp scratch now, I'm afraid. Okay, just as I insert that there. There we go. There we go. Well done. Just going to push a little bit more of that local anaesthetic into that area there. That's wonderful. Okay. Well done. Okay. I just need to give that little few moments to be nice and numb. Okay. Can you feel anything here? No? Okay. If I just get my blade, can you feel that? No? That? Can you feel that? No? That's fabulous. Okay. Wonderful. Okay. So I'm now just going to extract that bit of tissue, okay? Little incision behind. So you might feel a little bit of movement, a little bit of tugging, but you shouldn't feel any pain. If you feel anything, please just pop up your hand for me. Alright, because I don't want you to feel a thing. Okay. Alright then, here we go. Please keep still, but do pop up that hand. Okay. Okay then. Alright. Here we go. Are you okay there? Good. Just removing a very neat piece of tissue which is going to form over your eardrum. Still nice and comfy. That's good, that's good. Okay. Okay. There we go. That's that. I just need to pop that in there. Okay. just going to give this a dab around there. Okay, come back to that in a little while. Alright. Okay. So now I'm just going to insert the tissue over the eardrum. Okay, I do need you to keep very, very still for this. I'll be having a couple of tools in your ear whilst I do it. Alright, okay, here we go. Okay, here we go. So, just need to double check that, grab that with a tool. Alright, okay, so going in now with the light. Okay. Tell me if you can feel anything. And now, just going in with that tissue. Just have to go in a little bit deeper now. There we go. Well done. Well done. That's perfect. And placing the tissue over the perforated eardrum. Repositioning a little bit there. Okay. Okay, that's in place. Let me just withdraw that. Okay, wonderful. Okay. So now what I have to do is I have to get this. Okay. This is a special gel, and I have to fill your ear canal with this, and this will get the tissue to stay firmly in place so it will heal around that open part of the eardrum. Okay? This would feel rather cold, but because you're numb you won't feel this. Okay, and keep nice and still for me. So I'm just going to be injecting this into the ear canal. Just going to put that in there. Okay. Oh, there we go. There we go. Okay, that's going in very nicely. Okay. Perfect. There we go. Wonderful. Just pop that down there. Okay, so I'm just going to have a little look with the otoscope now. Okay. Let's pop that on. Okay, I won't be able to see too much because your ear is actually full of the special gel. That looks amazing. Okay. Alright. Are you feeling okay? Good, good. Okay. So what I need to do next is to stitch up the little piece of tissue behind your ear, okay? Alright, so there's just one little piece taken. I just need to do a little stitch just to stop it. It's not actually really bleeding, but I just have to put a stitch in and dress that. Yeah, okay. Okay. Gently on these. rather tough to open sometimes. Okay, here we go. So, now these sutures will dissolve on their own, okay? I might just have to put a couple, but that'll be all it needs. Okay. And you won't feel this because you are numb, but tell me if you do feel anything at all, okay? Keep nice and still for me. I'm just going to pop suture there, wrap it around there. Okay, that's one. And here's the next one. Wonderful. Okay. So let me just have a little inspection of this now. That's looking wonderful. Just going to give ear a little wipe there. Very gentle wipe. Now I'm going to have to put a dressing over your ear, okay, which will be need to change daily, okay. Now obviously we will give you some dressings to take away with you, and the nurse will explain what to do with that, but once it's on, if you can keep it as dry as possible, okay, change it daily, gently. When you take it off, just gently clean the ear, obviously not going down there, just gently. Try not to touch the sutures, then replace the dressing, but the nurse will go through all that with you. Alright? Okay, and it will be a nice comfy dressing, I promise. Okay. The dressing will need to be in place for a couple of weeks, and we'll have you back then, okay, to check everything. Alright, so this is going to go right over your ear. Very gently over your ear. Nice and soft. Isn't that lovely? Yes. It's really, really nice. There. Okay, and what I like to do, even though they have a good adhesive, I just like to add a little bit of tape, just to make sure. And this tape doesn't pull your skin, it's really good, okay? Your hearing is obviously going to be a little bit different for a while, but it'll soon be fixed when all the dressings come up. How does that feel? Okay. Now, there are some guidelines which are quite obvious. Don't go swimming, okay? No flying, no heavy lifting, no exercise. Don't get the area wet, okay? Until the dressings are off fully in a couple of weeks, okay? If you do start to experience any real pain, okay? When the anaesthetic wears off, it will feel a little bit strange for a while. But if you do get any dizziness, okay, you start to feel warm, pain, nausea, anything, you must call us, okay? But the chances of that happening are very, very, very slim. But there's always a risk of infection with any procedure. Yeah, okay. So, you're not feeling dizzy or anything now, are you? No, that's good. That's absolutely fine. Well, I'm happy with that. That dressing looks perfect. Okay, it's covered up the suture behind as well. Okay, and also with the suture, if you do notice anything like it's feeling hot or puffy where you can feel, again, just let us know. If it starts to itch, that's not necessarily such a bad thing. That will probably happen after several days. Okay, as the stitches start to heal, they can become very itchy. I know it's quite irritating when you've got that dressing on, but please try not to scratch. Okay, alright, so I will leave you in the capable hands of my nurse, and she will give you all the aftercare. We're not going to send you home just yet, okay? You're going to sit and you're going to have a nice cup of tea and something to eat, okay? And we'll keep a check on you. We'll check some obs before you go, okay? Make sure all's fine, blood pressure, everything, and that you're all good to go. And then, have you got somebody waiting for you? That's fine, yes, that's okay, as long as they're aware. But we'll find them. Are they in the waiting area? Oh, they went for a coffee. Okay, we'll find them. We'll contact them and let them know when you're ready. Okay, but if they're out there, they're welcome to have something to eat and drink with you as well. Okay, so I'll be seeing you back here in a few weeks. So enjoy the rest of your day, rest up and take care.